Welcome. In this video, we'll explore the most common symptoms of bronchitis, a condition that affects the airways in your lungs. Bronchitis can be acute or chronic, but both types share several key symptoms. Understanding these signs is important for early detection and effective management. We'll break down each symptom, explain why it happens, and help you recognize when it might be time to seek medical advice. Let's start by understanding what bronchitis is and why it causes such noticeable changes in your body. Bronchitis is an inflammation of the bronchial tubes, which carry air to and from your lungs. This inflammation can be triggered by infections, irritants, or chronic conditions. When the lining of these tubes becomes swollen, it leads to a range of symptoms that can affect your breathing and overall comfort. Bronchitis is often divided into acute, which is short-term, and chronic, which lasts for months or even years. Both types can cause similar symptoms, but chronic bronchitis is usually more persistent and severe. One of the hallmark symptoms of bronchitis is a persistent cough. This cough is your body's way of trying to clear mucus from the inflamed airways. It often starts dry, but can become productive, meaning you may cough up mucus. The cough can last for several weeks, especially in acute bronchitis, and may be worse at night or in the early morning. If you notice a cough that won't go away, especially after a cold or respiratory infection, it could be a sign of bronchitis. Another common symptom is increased mucus production. As the bronchial tubes become inflamed, they produce more mucus than usual. This mucus can be clear, white, yellowish, or even green. The color can sometimes indicate the presence of an infection, but not always. Coughing up mucus is the body's attempt to clear the airways and make breathing easier. If you notice a change in the amount or color of your mucus, it's a sign your airways are irritated. Shortness of breath is a frequent complaint among people with bronchitis. The inflammation and excess mucus can narrow the airways, making it harder to move air in and out of the lungs. You might feel winded after mild activity or even while resting. This symptom can be especially noticeable in people with chronic bronchitis or those who already have underlying lung conditions. If you find yourself getting out of breath more easily than usual, it could be related to bronchitis. Many people with bronchitis experience discomfort or even pain in the chest. This can feel like a tightness, soreness, or mild ache, especially when coughing or taking deep breaths. The discomfort is usually due to the constant coughing and the inflammation of the airways. While chest pain can be alarming, it's important to note that in bronchitis, it's typically mild and related to the cough. However, severe or persistent chest pain should always be evaluated by a healthcare professional. Fatigue is another common symptom of bronchitis. Fighting off an infection or dealing with constant coughing can leave you feeling tired and drained. You may notice a lack of energy, difficulty concentrating, or a general sense of weakness. This fatigue can last as long as the other symptoms persist, and may take some time to resolve even after the cough improves. Rest and hydration are important for recovery. A mild fever and chills can sometimes accompany bronchitis, especially if it's caused by a viral or bacterial infection. The fever is usually low grade, meaning it's not very high, but it can make you feel uncomfortable. Chills may come and go, and you might notice sweating as your body tries to regulate its temperature. If you develop a high fever or persistent chills, it's important to seek medical attention, as this could indicate a more serious infection. Wheezing is a high-pitched whistling sound that can occur when you breathe, especially during exhalation. It happens when the airways are narrowed or blocked by inflammation and mucus. Not everyone with bronchitis will wheeze, but it's a common symptom, particularly in people with asthma or other lung conditions. If you notice a whistling sound when you breathe, it's a sign that your airways are irritated and may need attention. A sore throat often accompanies bronchitis, especially in the early stages. The irritation from frequent coughing can make your throat feel scratchy or painful. Sometimes, the infection that causes bronchitis can also affect the throat directly. Drinking warm fluids and using throat lozenges can help soothe this discomfort. If your sore throat is severe or lasts longer than a week, it's a good idea to consult a healthcare provider. Bronchitis often develops after a cold or other upper respiratory infection. As a result, you might experience a runny or stuffy nose, along with your cough and other symptoms. Nasal congestion can make breathing through your nose difficult and may contribute to mouth breathing, which can further irritate your throat and airways. Managing nasal symptoms with saline sprays or decongestants can provide some relief. Headaches can occur with bronchitis, often as a result of persistent coughing or sinus congestion. The pressure from coughing can strain the muscles in your head and neck, leading to discomfort. Additionally, if you have a fever or are dehydrated, headaches may become more noticeable. Staying hydrated and resting can help reduce headache severity during bronchitis. Muscle aches, or myalgia, are common when your body is fighting off an infection like bronchitis. You might feel soreness in your back, chest, or limbs, especially after bouts of coughing. These aches are usually mild and improve with rest and over-the-counter pain relievers. If muscle pain is severe or persistent, it's important to rule out other causes. Occasionally, people with bronchitis may notice small streaks of blood in their sputum. This usually happens due to irritation and minor damage to the lining of the airways from frequent coughing. While a small amount of blood is not uncommon, large amounts or persistent bleeding should be evaluated by a doctor immediately, as it could signal a more serious problem. Noisy breathing, such as rattling or crackling sounds, can occur in bronchitis due to mucus moving in the airways. These sounds are often more noticeable when you take deep breaths or after coughing. Noisy breathing is a sign that your airways are not completely clear and may need medical attention if it worsens or is accompanied by severe shortness of breath. Loss of appetite is a less obvious but common symptom of bronchitis. Feeling unwell, tired, or feverish can reduce your desire to eat. It's important to try to maintain good nutrition and stay hydrated, even if your appetite is low. Eating small, frequent meals and drinking plenty of fluids can help support your recovery. Bronchitis symptoms, especially coughing and congestion, can make it difficult to get a good night's sleep. You may find yourself waking up frequently or having trouble falling asleep. Using extra pillows to elevate your head and keeping your bedroom air moist with a humidifier can help improve sleep quality during recovery. Hoarseness or changes in your voice can occur with bronchitis, especially if your throat is irritated from coughing. Your voice may sound raspy, weak, or deeper than usual. Resting your voice and staying hydrated can help your vocal cords recover. If voice changes persist after other symptoms resolve, consider seeing a healthcare provider. Some people with bronchitis may experience mild ear discomfort or a feeling of fullness. This can happen if congestion affects the eustachian tubes, which connect the throat to the middle ear. Ear discomfort is usually temporary and improves as the respiratory symptoms resolve. Eye irritation, such as redness or watering, can sometimes occur with bronchitis, especially if you have a viral infection. This is usually mild and resolves as your overall symptoms improve. Using artificial tears or cool compresses can help soothe irritated eyes. Some people with bronchitis may experience mild nausea, especially if they are coughing frequently or taking certain medications. Nausea is usually temporary and can be managed by eating small meals and staying hydrated. If nausea is severe or persistent, consult your doctor. An increased heart rate, or palpitations, can sometimes occur with bronchitis, especially if you have a fever or are feeling anxious about your symptoms. This is usually mild and temporary, but if you experience a racing heart or chest pain, seek medical attention. Dizziness can occur in bronchitis, especially if you are dehydrated, have a fever, or are coughing a lot. Standing up slowly and drinking plenty of fluids can help reduce dizziness. If you feel faint or your dizziness is severe, it's important to get checked by a healthcare provider. Back pain can sometimes occur with bronchitis, especially after frequent coughing. The muscles in your back may become strained or sore. Gentle stretching and rest can help relieve this discomfort. If back pain is severe or persistent, consult a healthcare provider. Mild sweating can occur with bronchitis, especially if you have a fever or chills. Sweating is your body's way of regulating temperature. It's important to stay hydrated and wear comfortable clothing to help manage this symptom. Joint pain can sometimes accompany bronchitis, especially if you have a viral infection. This pain is usually mild and affects the larger joints, such as knees or shoulders. Over-the-counter pain relievers and rest can help manage joint discomfort. Feeling anxious or worried about your symptoms is common when dealing with bronchitis. Shortness of breath and chest discomfort can be unsettling. Practicing relaxation techniques, such as deep breathing or meditation, can help manage anxiety during recovery. Chronic illness or persistent symptoms can sometimes lead to feelings of sadness or mild depression. It's important to acknowledge these emotions and seek support from friends, family, or a mental health professional if needed. Taking care of your mental health is just as important as managing physical symptoms. Some people with chronic bronchitis may notice mild weight loss, often due to reduced appetite and increased energy use from coughing and fighting infection. Maintaining a balanced diet and monitoring your weight can help prevent excessive weight loss during illness. Dehydration can occur if you have a fever, are sweating, or are not drinking enough fluids due to feeling unwell. Signs include dry mouth, dark urine, and feeling thirsty. Drinking water, clear broths, or electrolyte solutions can help prevent dehydration during bronchitis. Paleness or a washed-out appearance can occur if you are not feeling well or are slightly dehydrated. This is usually temporary and improves as your symptoms resolve. Eating well and staying hydrated can help restore your normal color. Mild swelling, especially in the ankles or feet, can occur in people with chronic bronchitis. particularly if there are underlying heart or lung issues. Elevating your legs and reducing salt intake can help manage swelling. If swelling is severe or sudden, seek medical advice. A mild rash can sometimes develop with viral bronchitis or as a reaction to medications. The rash is usually not severe and resolves as the underlying illness improves. If you notice a widespread or itchy rash, consult your doctor. Itching can occur with bronchitis, especially if you have a rash or dry skin from dehydration. Moisturizing your skin and avoiding harsh soaps can help relieve itching. If itching is severe or persistent, seek medical advice. Swollen lymph nodes in the neck or under the jaw can occur as your body fights off infection. These nodes may feel tender or slightly enlarged. Swelling usually resolves as the infection clears. If lymph nodes remain swollen for more than a couple of weeks, consult your doctor. Sometimes, the mucus you cough up with bronchitis may have a mild odor. This can be due to infection or the presence of bacteria. Good oral hygiene and staying hydrated can help reduce sputum odor. If the odor is strong or foul, consult your healthcare provider. Changes in taste can occur with bronchitis, especially if you have a stuffy nose or are taking certain medications. Food may taste bland or different. This usually resolves as your symptoms improve. Maintaining good oral hygiene and staying hydrated can help. Bad breath can occur with bronchitis, especially if you have a lot of mucus or a sore throat. Bacteria in the mouth and throat can contribute to this symptom. Brushing your teeth regularly and drinking water can help keep your breath fresh. Some people with bronchitis may notice increased sensitivity to strong smells, such as perfumes or cleaning products. This can trigger coughing or make symptoms worse. Avoiding strong odors and ventilating your living space can help reduce irritation. The mucus produced in bronchitis can sometimes become thick and sticky, making it harder to cough up. Drinking plenty of fluids and using a humidifier can help thin the mucus and make it easier to clear your airways. Some people with bronchitis may notice an increase in the amount of mucus they cough up. This is a sign that your airways are producing more mucus to trap and remove irritants. Monitoring the volume and color of your sputum can help track your recovery. Changes in the color of your sputum, such as turning yellow or green, can occur with bronchitis. This can indicate the presence of infection or inflammation. If your sputum becomes very dark, red, or foul-smelling, seek medical advice. You may notice a change in the taste of your sputum when you have bronchitis. This is usually mild and temporary, resolving as your symptoms improve. Good oral hygiene and staying hydrated can help reduce unpleasant tastes. Most cases of bronchitis improve on their own, but there are times when you should seek medical attention. If you experience high fever, severe shortness of breath, chest pain, large amounts of blood in your sputum, or symptoms lasting more than 3 weeks, it's important to see a healthcare provider. Early intervention can help prevent complications and ensure you get the right treatment. To sum up, bronchitis presents with a range of symptoms, from persistent cough and mucus production to fatigue, mild fever, and more. Recognizing these signs early can help you manage your health and seek care when needed. Remember, most cases are mild and resolve with rest, fluids, and time. If you have concerns or your symptoms worsen, don't hesitate to reach out to a healthcare professional. Take care and stay healthy.